Most guys think of testosterone as a sex hormone, but that's really, well, just the tip of what it does for your health and your well-being. Testosterone is a natural part of every man's body and is critical for keeping certain things running smoothly. It can also get out of balance, especially as you get up in years, causing side effects that can make you feel far from your best self. Perhaps you've been noticing low energy levels, lack of focus, a depressed mood, or lower self-esteem than usual. Maybe you've been feeling like your workouts are waning and your libido is lackluster. Looking in the mirror, you might see more belly fat, decreased muscle mass, and a man you barely recognize. While these symptoms can point to many different health conditions, and some are just a part of this thing called aging, we here at Peak look at what is going on in your body to determine if low T could be to blame, and whether we can fix you up with a little internal rebalancing. First, we measure your biomarkers, which is just a fancy way of saying we test your blood. There are a lot of ways of determining healthy testosterone, but at Peak, we base our care on the AUA, American Urological Association guidelines, that a healthy male testosterone levels fall between 300 nanograms per deciliter and 900 nanograms per deciliter. While these levels vary throughout the day, this line represents the average testosterone level of a man over the course of his life. Unfortunately, it's not as easy as just seeing if you fall in or out of the range and calling it a day. That's because your baseline matters too. A reading of 350 nanograms per deciliter, which is slightly low, may not be worrisome if you've been in the 300 to 400 nanograms per deciliter range your entire life. However, if your body is used to your levels being closer to 900, that drop could cause some serious problems. On top of that, there are several other important hormones like free testosterone, LH, PSA, and estradiol that all work together to impact your energy. We'll dig into those more in another video. But these biomarkers alone are just part of your story. That's why we also ask you about how you're doing. We want to understand any symptoms you've been experiencing so we can see if and how low testosterone is showing up in your life. We give this information to our medical team who compares your experience to data from other men to figure out what's going on and how to come up with a treatment plan to help you feel better and be on the up and up. Some will feel like a new man immediately, while others may need a couple more months to fine-tune their solution. We're all different on the inside, and we plan on treating you that way, with a plan that is built specifically for you. We're going to be honest with you. We can't turn you into your 25-year-old self again, and aging is normal. And testosterone is not a fountain of youth, but optimizing your hormones can go far in giving you more energy and making you feel ready and excited to take on the many years ahead.